And welcome to the program. I'm joined by Dr. Patty Gibson. She is the co-founder and chief medical officer at the Arkansas Behavioral Health Integration Network, and Dr. Chad Rodgers, pediatrician and chief medical officer at the Arkansas Foundation for Medical Care. Welcome to both of you. And Patty, I want to begin with you first. Tell me a little bit about the network that you are a co-founder of. I think there will be some people watching that have not heard of it before.
Yes, ABN, as we call it, is Arkansas Behavioral Health Integration Network, and we are a nonprofit corporation. We formed as a committee, a subgroup with comprehensive primary care clinics working to increase the quality of their care and work with payers. And we all saw as a group that increasing training and ability for primary care practices to provide behavioral health care, mental health care in their primary care setting, that there was a big need for training. So ABN, we've established as an organization that is focused on providing training and connecting primary care practices to mental health care. And we don't provide any type of mental health services, but we are about training and helping people learn how to provide this type of care.
All right, very interesting. Chad, Dr. Rodgers, you are a primary care physician for a lot of kids in the state of Arkansas. Tell me what you're seeing in terms of the need that Patty's organization is filling, and just and how you're seeing it kind of work its way in real time.
Right. So, in primary care, we do end up doing a lot of mental health, and there just aren't enough psychiatrists in the state to handle everybody who is having some mental health issues. And a lot of times those mental health issues are very, direct. They're very straightforward. It's depression, anxiety. People just, they're maybe getting some counseling, but they need, some med management to kind of help them deal with that. So as a primary care provider, though, in my training, in after med school, didn't get a whole lot of mental and behavioral health. It was something more that I had to learn as I went into practice and through experience. And of course, as Dr. Gibson was talking about, the mental health training that had been done in the past was really helpful to me as a primary care provider to do that better.
So I don't have to tell either one of you, and Patty, I'm going to come to you first, but Chad, I want you to weigh in on this too. There was a mental health crisis in Arkansas and in America before the pandemic hit. Speak to me a little bit about the context of where we've been with mental health in our country, and really kind of how the pandemic has made it worse from your point of view. Patty, I'll come to you first.
Right. Our healthcare system in America has been very focused on specialists. And so medical specialists, primary care providers tend to practice in one location and have certain payers and providers, whereas our mental health system has been very separate, very fragmented, with separate providers, separate locations, and separate payers. And what we found even before the pandemic is there was barriers to getting patients who needed mental health care from primary care into the mental health specialists. There's not enough mental health specialists to provide all the care, and we mean psychiatrists, psychologists, therapists. And so many people, there were long wait times to get an appointment, and the stigma of having to go to another place to get care often kept people from going. So before the pandemic, we found that many of the people who needed mental health care did not get it. And what they did get, most of their care was provided by their primary care provider.
Chad, and from your perspective, what have you seen kind of in practice?
Yeah, I think the pandemic has really highlighted many of the things that Patty mentioned. That's very disconnected between the mental health world and the physical health world, and kind of bringing those together, whether that's under one roof or under and the kind of a better coordination of communication between the two areas. It's during the pandemic, just have seen a lot of people experiencing a lot of anxiety, which is totally understandable. Of course, people are feeling very socially isolated and don't have the normal social supports they need. So a lot of just people being very depressed. It's kind of almost half of my day sometimes spent with my teenagers talking about just the anxiety and the depression associated with the pandemic. But hearing the same from my family practice colleagues and my internal medicine colleagues who do primary care. So the pandemic has really highlighted where those weaknesses have been and are in our healthcare system.
Chad, I want to stay with you on this question right here. You know, we like to kind of talk about the intersection of business and politics and policy. What needs to happen from the state's perspective to get a little bit better coordination to address this situation? Is it more money? Is it more physicians in a certain area? I know Patty mentioned that earlier there, but what needs to be, what's involved in getting better coordination?
Yeah, we really need to do some things to incentivize people going into mental health, and especially among minorities. There are not enough minority health mental health providers, which is really important to making those good connections between mental health providers and their patients. So giving some incentives for people to go into mental health, to go into psychology, to seek psychiatry residencies, and people who do social work to think about going into doing more mental health. So I think those are the areas that our state could really improve in.
Patty, what do you see from your perspective? And maybe speak to me too about, I mean, is there an entryway for, I guess, connecting with employers who are maybe dealing with a workforce that is experiencing maybe a higher number of mental health kind of issues because of the pandemic?
Yes, I think for the first step for all of this is awareness, and employers, as well as insurance payers, as well as medical providers, primary care doctors of all types, is to be aware and to think about actually someone's mental stress or emotions may be affecting their physical health, and it also may be affecting their performance at work. On the job, there's good data to show the cost to employers for employees' mental health issues, whether they be very severe mental disorders or even what we might consider milder, just anxiety, stress, feeling down, feeling distressed and worried about their families. So awareness is one thing, and then to explore and ensure that we have resources, that employers provide resources, including a good EAP system, and to look and make sure that their insurance benefits really do provide good practical ability for employees to get care. Oftentimes they think that the resources are there, but they need to look closely at what the actual benefits really are.
Patty, I may be giving you this question as a little bit of shameless self-promotion, but where does someone start in terms of finding what these resources are?
Well, Arkansas Behavioral Health Integration Network, we are one place, and we have a website, abennetwork.org, and we have worked in the field and trying to be advisors and consultants to employers, to insurance companies, as well as to primary care providers and mental health providers, as a way for us all to be connected. There's also the American Psychiatric Association does have a Center for Workplace Mental Health, and the American Medical Association has a Behavioral Health Integration Collaborative website. So talking to each other, your colleagues, your employees, your medical providers, I think is an important place to start, and let's be problem solving as to what the particular needs are.
And Chad, they're not going to all come see you. So where would you direct people for, I guess, a starting point if they know they've got an issue, whether it's an individual or whether it's an employer?
Yeah, I think as an individual, if you're having some mental health problems, I think your primary care doctor is probably the best place to start as far as getting in somewhere quickly. But, if you're feeling suicidal or you're thinking about harming yourself or harming somebody else, that becomes sort of a medical emergency, just almost like you would treat a heart attack. You need to go to an emergent care center, such as an ER or one of the mental health hospitals around the state to get assessed. I wouldn't put it off. I think this is a real important time to be addressing mental health needs. We need to all come out of this pandemic as healthier and happier people.
All right, Dr. Patty Gibson and Dr. Chad Rodgers, I appreciate you both very much. Very informative. Thank you so much for your time.